Hi, I'm Carl Stoddard, and welcome to Dr. CFO. I founded Dr. CFO back in 2010 to help doctors and dentists understand their numbers better, with the real purpose and the real meaning is to help them become rich. We know that you have somebody looking at your taxes, and you may have somebody do wealth planning, but our purpose, looking at your business, is you becoming rich. And an important part of that is understanding your numbers so that you can make sure that there is money to help you become rich. So that's the ultimate goal of Dr. CFO. I built my first forecasting model working for a $600 million semiconductor company where I developed a report called The Flash. The executive team and the CEO looked at it every week. My presentation style was very successful. Back at that time, I wondered why doctors and dentists weren't getting me that kind of information. I have a brother who's a dentist and a brother who's a dermatologist. And so we started experimenting with them and it became successful, and I continued to grow and grow and grow, and eventually left the semiconductor company to do Dr. CFO full time. Since leaving, I estimate I have done 7,000 client meetings. And during those 7,000 client meetings, this report has evolved and developed and expanded based off questions that you as a provider asked or your office manager asked. And so that's how the product grew. And that's how the product continues to grow, is based off questions that are asked. So what is it like working with me? Well, I'm a little different. I'm not just gonna send you a report necessarily every month. Initially, if you're like on the quarterly plan, we're gonna have at least 3 monthly meetings to kick it off, to get used to it. And then I will send you a monthly report, and then we'll meet every 3 months or so to go through the numbers. Now, to me, the preferred team is it's me and you and your office manager. That's the team. And we're gonna categorize and we're gonna track the numbers, of course, but there's going to be like action items that either I need to work on, or you need to work on, or your office manager needs to work on. It's not just fluff. And that's how we get results, as we work on meaningful things as the numbers tell us to work on. I'm gonna look at maybe 30 numbers every month, and I'm gonna start with your top 3 numbers. Now, if you don't know what those are, I'm gonna tell you what they are right now. Okay, so if you decide to work with me or not, these are the numbers that you should be looking at. The first number is how many days do you work? If you're not open, well, you can't make money. And that's actually true for any business, whether it's a doctor, a dentist, a repair shop, it doesn't really matter. If you're not open, well, you can't make money that day, and that day's gone. If you have multiple practices or multiple doctors in your practice and everybody wants to take a vacation on the same day, well, that's not a good idea. The second number is how many patient visits do you see? You might be surprised that you might be able to get away with seeing fewer patients than you think, but if you don't have the same number of patients coming through, and really the same number every day, it's really hard to balance the workload. So that's another thing that we look at. It's a very important number. If you don't have the patients, obviously, you're not going to make money. So that first one is days, the second one is patients. The third one is how much are you getting for each patient? You know, I call that the average patient charge, APC. How much are you getting for each patient? And that's another thing to look at. If you're insurance-based, well, they like to cut the rate, so how do we increase it? If you're cash-based, well, you have a lot more flexibility. So how do we be disciplined to increase the rate, keep the same number of patients, and be open as many days as makes sense? Okay, so those are the top 3 numbers. In addition to that, I'm gonna gather maybe 25 other numbers to add to that from your billing system, whether it's NextGen, Eaglesoft, Dentrix, Modernizing Medicine. It doesn't really matter what the system is. I'm used to all of them, and I'm used to a lot of the quirks that they have. And then we're gonna pull from your accounting system, which is generally QuickBooks, and that's what we use to compile a report. Generally, it's about 30 or so numbers every month. And from that, we get an unbelievable amount of information. So what do you get from that information? So where's your profits really coming from? You know, do you have a staff? Are you paying too much in staff? Is your supplies too much as compared to yourself and as compared to maybe a competitor? What do I think your practice is worth? I have a lot of other additional analysis in this, like evaluation and different modeling and simulations if you were to add a provider or whatnot. And we'll look at those things as we need to. But essentially the goal, like I said at the beginning, is to make you rich. That's the goal of Dr. CFO, is to help you understand your numbers so that you can make good decisions to help make you rich. One other thing I would say when you're working with me is I like to know things before you make a decision. So if you're gonna purchase a piece of equipment, if you're gonna hire a provider, I kind of like to know what those things are and know what those contracts are before you do it, so that we can make sure that it's aligned with the goal of making you rich. It's very forward looking, and the forward looking allows you to make business decisions backward looking, maybe some degree, but forward looking, much more powerful than backward looking. So that's what we do. Okay, if you're intrigued by this, reach out and let's schedule a demo and let's talk about in more detail what I can do for you. All right, thanks and have a great day.